Welcome to This Explainer. Today, we're jumping straight into a highly stressful, totally agonizing scenario that plays out in living rooms across the country every single day. We're talking about that exact moment when a medical emergency suddenly transforms into an absolute financial nightmare for an ordinary American family. It's a topic shrouded in confusion and, honestly, a whole lot of dread. But today, using our source material, we're going to break down the actual anatomy of a health insurance claim denial so you can see exactly how this machine works from the inside out. Right now, literally at this exact second, someone is opening a letter from their health insurance company, and you know they're opening it with shaking hands, just terrified to find those two glaring words stamped across the page: claim denied. It's an incredibly tense, gut-wrenching experience. And what almost nobody realizes is that millions of claims get rejected every single year. Not because a treatment wasn't needed, and not because someone made a silly little mistake. Often, claims are denied simply because the system is intentionally built that way.
So first things first, what are we actually dealing with here? Well, a claim denial is just the refusal of an insurance company to pay for a requested medical service. Simple enough, right? But looking deeper at our source material, we learned that a denial is often a calculated outcome of how the health insurance machine actually functions. It's not some personal vendetta against you, it's the result of a highly structured systemic process that patients almost never get to see.
Okay, Section 1, the motive, the business of health insurance.
To really understand why this happens, we kind of have to pull back the curtain and look objectively at the fundamental business model driving these companies. It all starts with a question I'm sure most of us have yelled in a moment of frustration. If you pay your premium every month on time without fail, shouldn't your insurance company just pay for your care when you need it? I mean, most people assume that paying those monthly premiums guarantees coverage when a health crisis hits. That's the whole point of insurance, right? But the uncomfortable truth lies in a very strict financial equation.
Like any business, an insurance company's bottom line relies on a super basic formula. Money in, which is the premiums you and I pay, minus money out, which are the claims paid for our medical care. Every single dollar they pay out for your surgery, your medication, or your ER visit, well, that's a dollar that doesn't go to their bottom line. And that dynamic creates built-in pressure points within the system where claims can get denied, sometimes fairly, and sometimes, well, not so fairly.
Which brings us to Section 2, the method, autopsy of a denial.
When you're sitting in a hospital bed just trying to recover and you're suddenly handed a $5,000 bill, you really need to understand that the denial wasn't just one single moment. It's actually a multi-stage gauntlet. It's this four-step process happening behind closed corporate doors that most patients don't even know exists. So let's break down each of these hurdles so you know exactly what you're up against.
Step 1, the paperwork. When you receive care, your doctor's office submits a formal request asking the insurance company to pay. But guys, this paperwork requires absolute pinpoint precision. It has to be filled out using very specific medical billing codes. Our source notes that just one wrong medical code, or even one tiny missing detail, can trigger an automatic rejection. And this happens before a human being ever even looks at your file.
Now, if you somehow scrape past the paperwork, you hit Step 2, the algorithm. Yep, a lot of insurance companies now use automated systems to scan incoming claims for red flags. They're hunting for things like an unusual treatment, a diagnosis that doesn't perfectly match the procedure, or just the higher-than-average cost. If the computer spots something that looks even slightly off, boom, it instantly flags the claim for denial or kicks it over for a deep dive review.
Then comes Step 3, which is honestly the most infuriating hurdle for patients: medical necessity. These are internal corporate guidelines. Basically, insurance companies employ their own medical reviewers. These reviewers compare your case against their internal criteria, and they can actually overrule your own doctor. Actually, scratch that. It's more like they label a treatment as not medically necessary, completely regardless of how strongly your actual treating doctor insists that you need it.
And finally, we reach Step 4, the fine print. Buried deeply, and I mean deeply, inside those dense policy pages are specific exclusions for certain conditions or treatments that just aren't covered no matter what. Insurance companies essentially bank on the fact that most patients never read those buried pages until it's far too late.
Moving on to Section 3, the impact, real people, real denials.
To really grasp the weight of this whole thing, we need to look beyond the algorithms and the paperwork. To see the real-world devastation of this gauntlet, let's look at a couple concrete examples from our source material. Take a case from 2021. A woman in Ohio was diagnosed with a rare autoimmune condition. Her doctor prescribed a specific medication that had worked for similar patients, but her insurance company denied it. They labeled it as experimental, even though, get this, the medication was fully FDA approved for her exact condition. This forced her into a massively stressful 8-month battle just to get the denial overturned and get the care she literally needed to survive.
Or take this other wild case. A Texas man rushed to the emergency room for severe chest pain. Thankfully, it turned out to be a false alarm, not a heart attack. Phew, right? Well, his insurance company turned around and denied the ER claim entirely. Their argument, because his symptoms didn't turn out to be an actual emergency, they weren't pain. This completely ignores the fact that chest pain is the #1 reason doctors universally advise people to go straight to the ER.
Now here is what you absolutely must take away from all this. These are not rare, isolated horror stories. Research shows a massive share of denied claims are never even appealed. It's not because the claims were wrong, it's because overwhelmed, exhausted patients simply don't know they have the right to fight back against this machine. They just assume the denial is the final word.
Which leads us perfectly into Section 4, the cliffhanger, the secret in the letter.
Here's the thing. Insurance companies are actually legally required to give you a reason for every single denial. Now, usually it's written in this wildly complex administrative language that's totally designed to overwhelm you and get you to just give up. But as our source points out, once you learn how to read this legally mandated language, everything changes. Like it says here, once you understand it, the entire system starts to look very different. The supposedly impenetrable system suddenly reveals its weak points, and that gives you the leverage you need to fight back.
And it all comes down to this. Buried inside almost every single denial letter is one tiny specific number. It's so small and it is incredibly easy to just gloss right over. But according to our source material, this hidden little number might just be the absolute most critical piece of evidence in your entire fight against a denial.
So what on earth does this hidden number actually mean? And more importantly, how exactly can you use it to beat the system and save yourself from crushing medical debt? Well, that is exactly what we're going to reveal in the next part of this explainer. You absolutely will not want to miss it. See you then.